Welcome, everybody. We're going to go ahead and get started. Thank you so much for joining us for our webinar today, Supporting Nutrition and Physical Activity through ESSA. We're excited you all could join us and hope that you enjoy our webinar today. My name is Alex Mays, and I'm the Senior Director of National Programs at Healthy Schools Campaign, which is the organization that is co-hosting today's webinar in partnership with the Alliance for a Healthier Generation. I'll be moderating our webinar today and just wanted to start us off very quickly by going through some logistics for the webinar. Our webinar is going to run for about an hour, and we will have a recording of the webinar and all of the presenter slides available to view. We'll email a link to the recording out to everybody who's participated today, and that should go out by Friday. And we'll also have everything up on Healthy Schools Campaign's website. And also at the webinar, we have a very quick survey at the end of the webinar, which we would really appreciate if you could take a moment to provide feedback on today's session. We will be sure to save time at the end of our webinar today for a question and answer session with our speakers. You can ask questions by typing them in to the questions box located on your control panel and hitting send. Send in those questions throughout the webinar. We'll be collecting them after all of the presentations and saving them for the end of the webinar when we will do our Q&A. We have a wonderful lineup of speakers joining us today. We have Nancy Brenowitz-Katz from the Alliance for a Healthier Generation, Kyle Garant from Michigan Department of Education, and Bonnie Richardson from the Louisiana Association for Health, Physical Education, Recreation, and Dance. Next slide, please. And so our agenda for our webinar today is really to ground us all in just providing an overview of the Every Student Succeeds Act and the opportunities it presents for supporting school health and wellness. Nancy's going to do a deep dive into the opportunities that the new law presents for addressing nutrition and physical activity. And then most importantly, we're going to hear from Michigan and Louisiana about how they have used the new law to really support physical fitness and how they're thinking about implementation in general. And then, as I said, at the end, we'll do our question and answer session. Next slide, please. So I'm going to go ahead and just get us started with an overview of the Every Student Succeeds Act. Next slide. For those of you who don't know Healthy Schools Campaign, which again is the organization that I work for, we're a Chicago-based nonprofit, and all of our work really sits at the intersection of health and education and is based around the simple, common sense notion that healthy students are better learners. And so we work to ensure that all students have the opportunity to learn in a healthy school environment, and all staff have the opportunity to work in one. Next slide. So bringing us to our topic today, the Every Student Succeeds Act. So I just wanted to provide a brief high-level overview to the Every Student Succeeds Act and then some of the key opportunities it presents for supporting health and wellness. The Every Student Succeeds Act was passed in December 2015, signed into law by former President Barack Obama, and it was passed with bipartisan support, and it is the most recent reauthorization of the Elementary and Secondary Education Act, which is our nation's education law. And most recently, the most recent authorization of the law was No Child Left Behind, which is a name that people are perhaps more familiar with than the Elementary and Secondary Education Act. So the Every Student Succeeds Act is the most recent reauthorization of that and sets the federal policy for our nation's schools. And the new law really presents a number of, a real shift in how education is presented as needing to not only focus on core academic outcomes, but really recognizing the role that supporting the whole child can play in supporting educational success. And so it specifically calls out the importance of supporting physical and mental health and well-being of students and recognizes a number of key ways in which that can be done. It's also important to note that the new law really transitions a lot of authority from the federal government to states. And that's specifically important for today's conversation, where we will hear from Michigan and Louisiana to see how they are really leveraging that opportunity that they now have to think about how they want to be implementing this new law in their state and meeting the educational needs of the students they serve. It's also, I wanted to point out that states are very much in the process of implementing this law, and the timing it really is now for weighing in and making sure that the issues you want to see addressed in your state around education are addressed. There are 2 deadlines for states to submit their plans outlining how they're going to implement the Every Student Succeeds Act. One was in April, and one is coming up on September 18th. And 17 states submitted their plans for the April deadline, and the remainder will submit for the September deadline. And Nancy will speak a little bit more about the states that have submitted and what we know from those states, but just wanted to emphasize that this is very much happening right now. Next slide, please. And so we really have focused on a number on 3 key areas of the law for supporting health and wellness, where this critical connection between health and wellness and a recognition of the importance of supporting the whole child is acknowledged. So specifically in Title I, which is the program that distributes funding to states and school districts with high percentages of low-income children, Title I includes for the first time a requirement that all states include a school quality measure as a part of their state accountability system. And so under the Every Student Succeeds Act, all states are required to create an accountability system that sets goals for schools and is used to really identify schools that might be underperforming. And so for the first time, that accountability system has to include a measure of school quality, which is really tremendous. And while it's not a requirement that that measure of school quality address health and wellness, it creates a really important opportunity to do so. And we're starting to see states doing that, thinking about using that measure of school quality to address physical fitness or issues like chronic absenteeism or school climate. In addition, under Title I, there's a requirement for schools to put out a public-facing report card, and there's chronic absenteeism is included as a requirement in that report card for the first time. And in addition, states can decide to include other measures, certainly measures related to health and wellness in those report cards. And also, there's a requirement that school districts do needs assessments to inform how they use funding to support underperforming schools. And those needs assessments are a really important opportunity, again, as Nancy will say, for supporting health and wellness. And then Title II addresses professional development and literacy, and again, some important opportunities for addressing health and wellness, specifically increased flexibility around how the funding for professional development can be used, and specifically calling out being able to use that funding to train school staff around things like chronic absenteeism. And then finally, Title IV in the new law includes funding for the student support and academic enrichment grants programs, and addresses community support for school success, and creates so designated funding for health and wellness activities that school districts can use. Next slide. And so the Alliance for Healthier Generation and Healthy Schools campaign have been really working to highlight the key opportunities the new law presents for supporting health and wellness. If you're interested in learning more, we put out a framework for action, which provides a great more detail about those opportunities, and you can download that following the link on this page, which we will also be sure to send out after the webinar. And on the next slide, you'll just see the key opportunities that there's more details about what the framework includes in terms of how the new law presents a chance to support health and wellness. So next slide. And we are, in addition, have put out kind of issue-specific addenda for the framework, and we released one around how to address chronic absenteeism through ESSA. We have one that we are excited to announce. We are just releasing on nutrition and physical activity, and so we will include a link to that as well, which goes into much greater detail about the content we will be covering today. And then very soon we'll be putting out one around how ESSA can be leveraged to support mental health and wellness. Next slide, please. And again, here's the link that you can access to see the addenda that we are releasing today on addressing nutrition and physical activity through ESSA implementation. Next slide, please. So I now want to hand it over to our key partner in this work, the Alliance for a Healthier Generation, and Nancy Brenowitz-Katz is going to be speaking in greater detail about the opportunities ESSA presents for supporting nutrition and physical activity and provide us with some more context around this issue. Nancy is the Director of School Partnerships for the Alliance, and in this role she builds and maintains cross-sector relationships with key national and local government agencies and non-governmental organizations, and she is leading the organization's work around ESSA. And prior to working at the Alliance, Nancy was the manager of the Healthy Schools Act initiatives at the Office of the State Superintendent in Washington, D.C. Nancy also served as the Dietetics Program Director at the University of Maryland, where she trains hundreds of students who went on to pursue careers in dietetics. She's a registered dietitian with a master's degree in nutritional sciences from the University of Maryland. So I will now go ahead and hand it over to Nancy to take us on our deep dive of our topic today.
Great, thanks Alex. Thank you for that nice introduction. As Alex mentioned, I'm with the Alliance for a Healthier Generation. Many of you may be familiar with our organization, but our overall mission is to ensure that the places where children spend their time support and promote good health. So our work is focused a lot on schools and out of school time spaces as well as juvenile justice facilities. And we also do some work in the policy space and with industry, the food industry and healthcare, trying to create sort of upstream solutions to make it easier for kids and their families and schools to access healthy food and physical activity. Next slide. So I'm going to talk a little bit more about the opportunities to integrate nutrition and physical activity into the ESSA state plans today. Next slide, please. I'm not going to go into too much detail, but I'm sure most of you are familiar with the leading nutrition and physical activity issues facing children. Lack of physical activity, food insecurity, low fruit and vegetable intake, high intake of sugar and sodium, all of which relate to childhood obesity. And schools, of course, are an excellent place to address many of these issues, as many children eat several meals a day at school, as kids are at school most of their time, so opportunities for physical activity in school can really make a difference in how much physical activity kids are getting overall. Next slide, please. So as I mentioned, over 30 million children eat 1 or 2 school meals daily. We are lucky that we have strong federal nutrition standards for school meals and competitive foods, and that local wellness policies are required. It is important to note that there's no national requirement for nutrition education. Some health education curricula include nutrition education, but many unfortunately do not. Next slide, please. So, and then going to physical activity in school, there's also no national requirement for physical education, physical activity, or recess. Although certainly you're all familiar with the CDC's recommendation of 60 minutes a day of physical activity for kids. And as I mentioned, schools are an excellent opportunity through PE, recess, activity breaks, walking and biking to school, before and after school activities. And it is recommended that all kids receive a minimum of 60 minutes a week of PE, and 50% of that should be moderate to vigorous physical activity. Next slide, please, sorry. The next couple slides go through some of the research on the relationship between nutrition and academic achievement, and in the interest of time, I'm not gonna go into this in a lot of detail. We will send the slides if you're interested in looking up these articles. But suffice it to say that there's lots of information out there, lots of strong research evidence of the relationship between participation in the school meal programs and just nutritious intake in general and higher school achievement. Next slide, please. And there's also similar research around physical activity. And then next slide, please. So, you know, we know that there's a strong research base to support the role of schools in supporting nutrition and physical activity, and in, you know, making the efforts to give opportunities to kids to get adequate food, healthy food, nutrition, and physical activity, and that this really does fit into the role of schools and the educational mission of schools, because we know of the relationship between all of these factors and academic achievement. So as Alex mentioned, there are lots of sort of levers within the Every Student Succeeds Act where health and nutrition, physical activity can fit in really well. And so one of the big opportunities is that for the first time in the history of this law, the new reauthorization of ESSA defines well-rounded education as including health and physical education. So this raised the importance of these subjects in the overall academic environment, and it also opens up the funding streams in Titles 1 and 2 to be used for these subjects, and finally supports the use of measures of health and wellness in accountability systems and state report cards. Alex mentioned that on the accountability system, and you can go ahead to the next slide. Alex mentioned that within the accountability systems, there was now a fifth indicator of student success and school quality and student success, I think is what they're calling it. So although it wasn't required that this be a health indicator, it certainly could be one. And we're actually seeing already that some states are including health indicators in their accountability systems. So for accountability systems, this could be something like a student fitness measure, PE minutes, and then other measures that might be more appropriate for school report cards are things like minutes of physical activity, PE class size, presence of a school wellness committee, adherence to local wellness policies, whether their health education standards fits into nutrition. And although the report cards are not the full-on accountability indicators, they are a way that the families and the community stay informed of what's going on in the schools, and they're also a way that perhaps different indicators could be tested out to see if there really is an association between them and academic achievement. Next slide, please. The other really important opportunity for health and wellness is really in the needs assessment. So the purpose of the accountability system is that schools will then be rated, if you will, as to how kids are performing, and schools that are performing low or that have student groups that have low performance are going to have to look deeply into their structure and do these needs assessments. And then based on these needs assessments, they'll be developing school improvement plans, they'll be identifying evidence-based interventions and professional development needs. And so the importance of including health and wellness information in the needs assessment is really, really critical. This really is a great opportunity for advocates to ensure that school districts are considering the impact of health and wellness on student achievement, to ensure that things like school climate, nutrition education programming, and physical education, physical activity are looked at in terms of how they relate to academic achievement. And so we really want to drive home the importance of the needs assessments, even in the states that at the end of this all don't include a PE or health and wellness measure in their accountability system. We would still see a great opportunity for advocates to support the inclusion of that data in the needs assessments. Because having that data in the needs assessments and having those areas addressed is really going to provide great data, great information for the next time the state has to revise their Every Student Succeeds Act plan, which will be in just 3 years. So we think that this will be an ongoing opportunity even after September when all the state plans are in. Next slide, please. So there's a variety of sources of data for nutrition and physical activity that could be used as part of the accountability systems or for the needs assessment. So these are things like student fitness assessments, such as the Presidential Youth Fitness Program and FitnessGram, school meal participation rates, local wellness policy reporting, which is required as part of the USDA's administrative review of the meal programs. There are tools such as the Alliance for Healthier Generations Healthy Schools Program Assessment, which is based on the CDC School Health Index. And lots of states have required reporting on local wellness policies. They may use their own survey, they may use the health index, they may use the Healthy Schools Program Assessment. So it's great to know that there's already data being collected in many schools across the country that could easily feed into these needs assessments, as could information that is being collected by the community, like by the health department, by a community hospital, and there's much more information on that in the document. But again, these are some of the data points that are specific to physical activity and nutrition. Next slide, please. The other really great opportunity to promote health and wellness is through professional development. So Title II is where the funding can be used to support all school staff. And because health and physical education are now included as part of a well-rounded education, that money can now be used to support teachers in those areas. And in addition to that, because it's for all teachers, all staff, staff can be taught on how to integrate health and wellness into their interactions with students overall. There can be training on nutrition education and how to integrate nutrition into other subject areas. I mentioned the PE health education. We could also train classroom teachers on the effective use of physical activity breaks. So there's lots of ways through professional development that nutrition and physical activity can be promoted. Next slide, please. Finally, Title IV. Some of you may be hearing there's still a lot going on around Title IV and what the funding level will be, but this Title IV student support and academic enrichment grants are going to go to the states, and then they'll be divided out to the districts. And they specifically mention use for student health and safety. And if a district receives over $30,000, they'll also have to do a needs assessment. The other place in Title IV where health and wellness, nutrition, physical activity can really, play in is through the funding for 21st century community learning centers, community schools, promise neighborhoods, which are really all efforts to support the whole child. 21st century being an after-school program, community schools very much school-based, promise neighborhood really community-based, but all of these efforts are really looking at how do we sort of help address all of the sort of non-academic issues that our children are facing and use those, use that to help improve academic outcomes. And so certainly health and wellness figures very prominently in all of these models. Next slide, please. Okay, so currently 17 plans have been submitted to the Department of Education, and you can just go ahead to the next slide, thank you. And this is the list of states that have submitted plans. The ones that are highlighted in bold are the ones that Healthy Schools Campaign and the Alliance have specifically been working with, and that we've had interactions with the Department of Ed or the superintendents where we've put comments in on the plans, where we've really been trying to push this agenda around health and wellness integration. And so the Department of Ed is currently reviewing these plans, and feedback will go back to the states. So even in the states where plans have already been submitted, there may be additional opportunities to weigh in on these issues. So the ship hasn't totally sailed yet, but also keep in mind that the deadline for the rest of the states is September 18th. Did I get that right, Alex? I think it's September 18th. And so there is lots of opportunity still to promote health and wellness integration, specifically nutrition and physical activity, as states are putting their plans together. We do have a little bit of information, if you go to the next slide, about what's showing up in the state plans so far around physical activity and health and wellness. So 14 states have included chronic absenteeism as either the or one of the measures of school quality. And this is something that we're very supportive of, even though in and of itself it's not a health measure, but because of the relationship between health and wellness and proper nutrition and food security and school attendance. 14 states are doing composite indicators, so they're going to take a lot of different indicators and put them together into one school quality measure. And we found that 5 already include some kind of measure related to physical fitness, and we're going to hear from 2 of those states today in just a moment. And then the additional 2 included a measure related to school climate. And so let's see, the next slide, please. So measures related to physical fitness could include the Healthy Fitness Zone Standard, or the, again, those are fitness measures, time spent in PE, military readiness, and you're going to hear a little bit more about Louisiana in a moment to look at how the school is supporting health and wellness. So there's lots of different ways that physical fitness and or nutrition are showing up in the plans. But we're really excited to see that they are. And then my next slide, I think, is my last slide, and that is just giving you some specific examples of nutrition and physical activity in the first state plans. Arizona is requiring professional development on the whole school, whole child, whole community model. New Jersey includes a focus on using funding to deliver PD related to physical education. Maine also is doing the same thing. And many state plans recognize the importance of a well-rounded education, health and wellness, school climate. So we're really excited to see what's happened so far with the small number of plans that have come out. And we see lots of great opportunity moving forward to continue with the integration of health and wellness and specifically nutrition and physical activity into these ESSA state plans. And with that, I will hand it back to Alex.
Great. Thank you so much, Nancy, for that wonderful overview of the new opportunities for supporting nutrition and physical activity in ESSA. So now I have the pleasure of introducing Kyle Garant, who is the Deputy Superintendent of Finance and Operations at the Michigan Department of Education. And Kyle has been a very strong leader and advocate in youth health, development, and safety issues in community-based nonprofits, local schools, and state governments for over 12 years. Currently, he's the Deputy Superintendent of Finance and Operations, and in that role, he provides leadership across a diverse spectrum ranging from financial management, state aid and school finance, to school support services, human resources, and other issues. So he has a BA in psychology from Long Island University, a master's in social work from the University of Michigan, and completed Michigan State University's Education Policy Fellowship Program. He's also served on numerous organizational boards ranging in focus from youth homelessness to adolescent sexual health. So Kyle, I will now hand it over to you to share what is happening in Michigan, and thank you so much for taking the time to join us today.
And thank you for having us and letting me share a little bit about what we're trying to accomplish here in Michigan to incorporate whole child aspects into our ESSA plan, not only our ESSA plan, but our state strategic plan for making Michigan a top 10 state in education for 10 years. If you can go to the next slide, please. Just want to give people a little understanding of what PE looks like here in Michigan. We are not strong in our policy or legislative requirements around physical education in our state, and our data shows it. This is our most recent youth risk behavior survey data that shows, almost 70% of our high school students didn't have physical education on one or more days in the past week. Next slide, please. That data plays out in our school health profiles that shows where the majority of our secondary students get their physical education, which is in their freshman year. You can see in 9th grade, 92% of our freshmen here in Michigan have received their PE at that grade level, which plays into our next slide, please. We have a requirement here in our state for the Michigan Merit Curriculum, kind of our state, to receive a state-sponsored diploma to graduate from high school. We have a half credit of health and education and PE education individually, but a lot of the way students achieve that is through taking physical education in their freshman year, and in some cases in eighth grade as well. We do a state survey of our own around physical education and physical activity, and again, the data isn't all that great. Only 3% of our K-5 buildings have daily PE. A majority of our students receive 90 minutes or less a week in PE, and approximately 3% of our high school students receive the national standards of 150 minutes or more of PE per week. Next slide, please. So our kind of policy and legislative environment for physical education is, again, it's not strong. We've had to fight a fight. I've been here with the Department of Ed now going on 12 years, and in my current role for a little over 3, and it's been a battle to show the linkage or to get policymakers, not only at the state level, but at the superintendents at the local level, to understand the importance of physical education and physical activity in the school environment. Our State Board of Education has adopted a model policy on quality PE and physical activity in schools back in November 2012. The majority of the recommendations that are in there are based on national recommendations and best practice. Our legislative environment, what's actually on the books law-wise in our state, just says for K-8 physical education shall be established and provided in all public schools of the state. But what that looks like and how much of it at every grade level is determined at the local level. So technically, if I'm a local superintendent and I offered physical education for a semester in 5th grade, I will have met the letter of the law. And as I mentioned earlier, our Michigan Merit Curriculum requires a half credit of physical education for graduation. Over the last couple of years, we've seen attempts to weaken that standard and allow other forms of physical activity, either in or outside of the school environment, count towards that credit. So some districts allow students who participate in marching band or participate in athletics to count that towards their half credit for physical education for graduation. Next slide, please. So as we as a state developed our ESSA plan, we really had a focus on the whole child and what makes for a well-rounded education. Obviously not just including academic subjects, but when you look at the arts, physical education, and culture and climate, early childhood opportunities, we really wanted to make sure that our plan reflected what we wanted and where we were driving for as a state, to make sure that all of our students have a quality K-12 experience and put them in a position to be successful for post-secondary opportunities. For us, for Michigan, we right around the time that we started developing our ESSA plan, we had a new state superintendent, and as part of that, he worked with us to develop a new state strategic plan, which we call our Top 10 and 10 plan, which is our plan to make Michigan a top 10 state in education in 10 years. And so we had the craziness, but also the opportunity of developing not only our ESSA plan, but also our state strategic plan for education, essentially on the same time. And what we decided to, as a leadership team here at the department, we wanted to have our ESSA plan not drive our state strategic plan, but have our state strategic plan drive how we are going to use our resources in ESSA to meet the needs of the whole child. Next slide, please. I'm sure folks have seen some of the stuff that SHAPE has put out already, and if you can go to the next slide as well. Nancy and Alex have both talked about opportunities that ESSA provides to think about using resources differently to meet the needs of the whole child. Next slide, please. Again, this is kind of our roadmap for our 10 and 10 plan. Next slide, please. So we have 7 strategic goals that make up our state strategic plan for education, and we've really focused on, these are just kind of the high level goals, and there's 41 strategies over the 7 goals that get down into specific areas ranging from early childhood to teacher preparation to professional development, runs the gamut of the school experience. Where we focus most of our whole child work, especially around health education and physical education, has fallen in goals 2 and 4. And after the webinar is over, when they send out the resources, I'll send you a link to our full plan for those that want to see more about what we're aiming to do. Next slide, please. So here in goal 2, we're really focused on how we could provide quality opportunities in physical education around instruction and linking our physical education teachers in with our traditional classroom teachers. I don't know, in our state, there's a tendency for special education teachers to not get the same type of support, not only with amongst themselves as a cohort in a district, but also at a state level in terms of professional development opportunities and having time to learn and share best practices with other special education teachers. So we've really tried to focus on how we're incorporating special education teachers into that, into a model that we traditionally expect of all classroom teachers. Next slide, please. And goal 4 of our plan, we also focused on reducing risk factors, including poverty, and providing equitable resources to meet the needs of all students. I talk a little bit more about our accountability and our report card structure. That's likely going to be one of our measures, is how are we ensuring that all of our students have access to physical education, and then once that we kind of cross that barrier, that we will have an expectation or requirement around the amount of minutes that those students have to experience physical education in their district. So I also will share with Nancy and Alex to share with the group another set of slides. We are kind of smack dab in the middle of having the conversation with our State Board of Education on what exactly our dashboard will look like. For us, we've to this point, when you look at kind of a whole child or WISC model type indicators, we currently have our participation in school breakfast as part of our accountability structure, as part of our dashboard structure right now. We have some other social and emotional learning pieces that are already there, and so having that information prominently displayed helps parents understand how their school is helping focus on all dimensions of a child's development, as well as help our conversation at the policy level be more inclusive of the whole child. We will also use our comprehensive needs assessment that we're developing as well, to make sure that whether it's physical education, health education, social emotional pieces, physical and behavioral health services is another key component that we're really focused on. Will not only be part of, will be part of our comprehensive needs assessment, so that way schools will have to start answering questions and sharing that data with us. In our state, we get sued a lot and we lose a lot around data collection, and if we don't have identified dollars that are given to schools to support data coming and being reported to the state, we get sued and we have to pay more money. So anyways, as part of this plan, we've been able to kind of leverage the fact that they're getting federal money for this to increase our data collection, so we have a better understanding at the state level on who's doing what and what they're not doing, so we can better target our resources. In the end, as part of our accountability and report card structure, like I said, we're kind of smack dab in the middle of having that conversation with our board. I think we'll land on some sort of how students have access to PE in terms of teachers and student-to-teacher ratios, as well as minutes of PE, as we try and inch closer to meeting that national standard for our students. So I think that's where we will end up accountability structure-wise. We also have a couple of the mock-ups that I've seen so far of what the dashboard will look like. We'll also have truancy and chronic attendance as part of it. We're still trying to figure out whether or not, or what indicators make most sense around nutrition education and nutrition services. Essentially, we'll also have a level of early learning opportunities, access to art and other non-academic classes, or non-academic indicators, excuse me, as part of our student quality and student success metric in our report card. So our plan over the next 7 to 9 months, we just had our meeting with our accountability folks last Tuesday to talk about what our board's expectations are, what our expectations are of what the development will look like and what the indicators will or will not include. And so over the next 3 to 4 months, we'll be working with stakeholders across the state to get a better understanding or have some buy-in as to what those indicators will look like. It'll follow a very similar path that we had with our state strategic plan. And I guess one thing that I would share is for those that are looking to try and create a groundswell, as we went through that feedback process on our state strategic plan, we had a fairly robust stakeholder input process where we had numerous meetings with various groups, both in education and business and all kind of sectors. And we were really focused on making sure that the voices that speak in our state for the whole child experience, whether it's social and emotional and school nurses or school social workers or physical education, health education, they were at the table helping to have those conversations about what was important for Michigan students. So that really helped kind of set the stage for us in the sense of from there, having stuff in the comprehensive needs assessment, having stuff in ESSA and writing our plan to be more whole child focused was relatively easy because we had, the feedback and the stakeholder buy-in to say, hey, this is a plan we're developing jointly with our state, collaboratively with partners. So this is the direction that they're saying we should be going in, and we're going to make sure that we go in that direction as part of our work with ESSA and other forms of education policy in our state. And with that, I will turn it back over to Nancy. And thank you again for the opportunity today.
Great. Thank you so much, Kyle, for sharing the great work that's going on in Michigan. So I am now going to go ahead and introduce our next speaker, Bonnie Richardson, who is with the Louisiana Association of Health, Physical Education, Recreation, and Dance. Bonnie has been a physical education teacher for 34 years, and she's a national board certified teacher in early middle childhood physical education and is currently the president of the Louisiana Association of Health, Physical Education, Recreation, and Dance. I need to learn how to say the acronym so we don't have to keep saying it out. But we greatly appreciate the leadership and commitment that she's brought to Every Student Succeeds Act and implementation in Louisiana, and greatly appreciate her taking the time to join us today. So Bonnie, I will now hand it over to you to present.
Thank you very much, Alex. It's LAHPER, L-A-H-P-E-R-D, LAHPER. Very easy, but we're very excited to be part of this. You can go to the next slide. Our state has just revised our standards so that we can be in line with what Shape America standards are, and we're waiting for approval from the Department of Education. Our teachers do need to be licensed. When they're not, then it's with the understanding that they will go back and get their certifications. We've got physical education requirements for grades kindergarten through 12th grade. You may go to the next slide. With ESSA as a leverage point here in Louisiana, we have actually been very active in our state legislature, going and talking to our senators and legislators and letting them know how important physical education is. And back in 2002, we had language that was voted on and approved and is now state law that mandates that we do have 150 minutes for elementary school children for physical education. I believe the middle school is blocked, so they will have anywhere from 225 minutes to 250 minutes, I believe, and then it's mandated for high school to have 1.5 credits of physical education. But a couple of years ago, our State Department of Education put in a waiver that a quarter of a credit could be earned for students who are doing ROTC or band or dance line or something like that, or even going to health clubs and getting it certified. So we're working to have that changed if at all possible. Now with the ESSA opportunities, we my advocacy person and I went up to Speak Out Day last year, and we learned a whole lot and came back with a whole lot of information. And one of the things was that they asked us to go to town hall meetings and talk with our officials. And so we ended up going to a town hall meeting, and we stayed until we were the last ones there, and we got heard. And when the undersecretary turned around and looked, she was one of my parents. And when we told the superintendent of education that we had plans that we could help them with and that it was free, his eyes opened up and his ears perked up, and he looked at the undersecretary and said, get their information and get in touch with them. So not only did we have the opportunity to work with our State Department of Education, we were asked to come in and specifically work on Challenge 3, which was how are we going to get all of these different indicators in there, and they wanted us to look mainly at the obesity issue. And that's when we came up, and I went back and got in touch with some of the people from Speak Out Day and the information from them, and I called and talked with a friend of mine in Kentucky and said, okay, what are y'all doing? Because I knew that they were really working hard on theirs, and he gave me some information, and that got me in touch with the Alliance for a Healthier Generation, because the main thing was that we needed was to have this assessment, and we were looking at the school health index very strongly. We knew that Let's Move Active Schools had one, but we also knew that the Alliance for a Healthier Generation had one. And in their Healthy School campaign, they've also got this wonderful report that can be used, an aggregated report that we could send to the Department of Education. And you can go ahead and go to the next slide. It gave us the opportunity to address a lot of different things, not just physical education, but it has the health indicators of school wellness and working with your community. And so it gave me an opportunity to get in touch with a lot of different people and have them at this meeting. And I did get in touch with the person in New Orleans, a Healthy Alliance for a Healthier Generation person in New Orleans who works with our part of the state. And she couldn't make the meeting, so she got the person from the northern part of the state to come down, and Erica spoke, and we had our physical education person from the health department come in, and we had the undersecretary there with one of her cohorts, and we had 4 from LAFER who were there, and we had already all worked together on putting our heads together, looking at the different programs and coming up with what we thought was the best thing to present to the Department of Education. And when we told them what we suggested, and Erica came in and had all the information from the Alliance, then she was like, we don't want it to be something where they're graded, but we want to see where there is growth. And Erica filled in all the blanks that I couldn't give them. And so this was the puzzle piece that helped us to get our information across, because the Alliance for a Healthier Generation has their assessment, which is based on the School Health Index, and it met everything that we needed to do for our state assessment, for the needs assessment. So it was really neat when the undersecretary turned to all of us and said, I wish everybody, every group that we met with was as well prepared as y'all and gave us as much wonderful information as y'all. So they included this in there with the framework that was sent to Washington. And in with that, the 18 different subjects, if physical education in that interest and opportunities indicator, if the school already met all of that, then they could go on and they could keep working on it, but they could concentrate on other areas like art or science or whatever, civics, whatever the other one was. But we gave them the opportunity that this was one way that we could go about doing things that would help out. And I think it was the piece de resistance that helped them, and they have said that they will come back and ask us to help finalize the details. But we did send ours in April, and the one thing that we found out was that yes, we can come back and tweak a few things or add a few more things, but to be asked to come to the table and to be an active part of ESSA in our state, it was very invigorating and got us all working on it, and it was wonderful, and we really enjoyed being asked to do this. So we want to come down from being the #1 most obese state with children to, getting that well down and under control by using all the good things that we see with the Alliance and working with the state to make sure that we can do this. So thank you very much for asking me to come, and I'll kick it back to Alex.
Great. Thank you so much, Bonnie. It's just such a wonderful story of the impact that advocates can have. And as Nancy highlighted, there's very much still a role that people can play in commenting on whether it's their draft state plans that your states are developing to submit, or if it's helping with the implementation and making sure the issues that you care about are included in those needs assessment. There's still lots of opportunities to get involved. Here's our contact information in case anybody has follow-up questions. And I would encourage you all, if you have any specific questions for our presenters, to send them in right now. And we'll take the last 10 minutes or so here to ask our presenters the questions that you all have. So I will go ahead and kick it off with a question for Kyle, actually. So Kyle, we're just wanting to know if you encountered any resistance with suggesting including physical education and measure around physical fitness in the Michigan accountability system.
Not yet. Again, we're kind of just in the early stages of developing that. I mean, it was submitted as part of our plan, but the devil is always in the details. We have supportive board members on kind of both sides of the political aisle that understand that schools should be judged on more than just academics, and kids deserve more than just a focus on academics as part of their public education experience here in Michigan. So I mean that's helpful, and I think for the most part our schools intrinsically understand that whether it's PE or social emotional or climate culture, that those pieces obviously play a big role in a school's ability to be successful in education. So I also think we haven't gotten into the details enough yet to come up with here's what it's going to be and to have that pushback yet. So I guess I'm not anticipating that we'll have it, but so far so good.
Great, thank you, Kyle. So next question, and Nancy, maybe this is something you could provide input on, and I'm happy to give it some thought as well. So the question is, if your state plan barely mentions nutrition or physical education, what are 2 concrete things that could be submitted as comments to get those areas included? So Nancy has had the pleasure of drafting comments for probably 6 or 7 states, if not more. So I don't know, Nancy, are there things that you really felt like in drafting those comments that you emphasized and feel like are important pieces above others to leverage to get nutrition and physical education in state plans?
Yeah, I mean, it's maybe a little more so around the physical education than the nutrition, but I think, I mean, I guess 2 thoughts come to mind. One is that, getting physical education into the accountability system or physical fitness is a pretty high bar, and we're so thrilled to see that some states have been able to accomplish that. But I think you can see from, what Bonnie and Kyle talked about, that didn't happen overnight. That was a long trajectory to get that, and there was other things going on in the state, like Kyle mentioned, the State Board of Education plan, that were supporting that. So the 2 things maybe that come to mind, and then Alex, if you want to add, is that one, I would say recommending PE as an indicator for the state report card is a good start, because it's less high stakes, if you will, than the accountability system. And then it might be a way to sort of test out that indicator. And then the other, I guess, 2, well, maybe there's 3 things. The second thing I would say is that if you know that there's any data collection going on in your state, like for example, if your state's requiring some kind of reporting on wellness policies, or if your state is collecting the PE data, or if they are, even if it's just the wellness policy reporting that's part of the administrative review that USDA does for the school meal programs, I feel like you're always going to do better recommending they do something with data they already have and they're already collecting than suggesting some new data collection. So I think looking at what's already happening in your state, and then sort of in line with that is using those other things happening in your state as leverage. So like if you already have PE legislation on the books, if like Kyle mentioned, you know, they have some legislation, but a lot of places weren't implementing it. So, you know, trying to kind of show that, you know, your state already has a commitment, your state's already passed laws or put out plans that show that we want to have this impact. But here's this sort of ESSA is sort of this opportunity now to like put some funding towards it and to raise, sort of elevate it. I hope that answered the question. Do you have anything else, Alex?
I think that's great. I would just echo, I think we can't emphasize the, you know, data piece enough, and really looking at what is going on in your state, and that thinking of ESSA as a chance to really formalize existing policies or practices that might be there. And if there's the case that, you know, there isn't anything in terms of nutrition and physical education, I would definitely encourage you to look at recommendations around chronic absenteeism. All states are required to, I should say all schools are required to report chronic absenteeism data as a part of their, it's called the Office for Civil Rights Data Collection, which goes to the Department of Education. And so that they are reporting that chronic absenteeism data. So that's, you know, for lack of a better term, kind of the lowest hanging fruit, I think, and certainly a case can be made for that, you know, having a direct connection to nutrition and physical education. We know things like breakfast in the classroom is a research-based or evidence-based best practice for improving attendance, so has some direct connection there as well. But I think all of Nancy's additional points are right on. A question for Bonnie. So wanting to know, you really did a wonderful job highlighting the role that advocates can play in having an impact on their state plans, and wanting to know if you have suggestions for other groups that folks might be able to reach out to in their states, whether it's, you know, state chapters of your organization or other advocates that you worked with on this or saw at these meetings that you would recommend people contact.
Sure. First thing, go to the Shape America website and look at their advocacy, especially Speak Out Day, because all of the information is there. Be visible. Be approachable. Go and talk to your legislators. Go and talk to your superintendent of education, or if you have an in with an undersecretary, somebody. Be visible, be audible, be very polite. Have your talking points. Have your information with you so that you can say, this is what we can do. We can help you to do this. We can use the Alliance for a Healthier Generation. It's got the aggregated report. We can send the information to you. It's all done. It's right here. This is all you need to do. It makes their job a whole lot easier, and they like knowing that they don't have to create another assessment because they're having to do that with other things. But be visible, be active, be polite. That's one way that you can really get there. You don't get in there demanding things, but you can go in and say, I've got this information for you. We can help you. And they really like to hear that, and they're more willing to call you and get your information and say, yes, we'd like for you to come in to help us. So be active. Get the information you need, and again, the Speak Out Day has all the information on ESSA that you need to go to either your senators, your legislators, your congressmen, to let them know how important physical education, physical activity, health, all of that, wellness is very, very important. So just, again, be a good advocate for what we do.
Great. Thank you so much, Bonnie. And I just want to ask one last question for Kyle, hopefully not a long one. Wanting to know if you saw if you worked with any, had any cross-sector kind of collaboration in developing this, or if you're thinking of any cross-sector collaboration in terms of implementation. For example, maybe reaching out to your counterparts at the state health or public health agencies, or just supporting that type of cross-sector partnerships through implementation.
Sure. In our strategic plan, we have goals and strategies specifically around reaching out to other partners, whether it's other state departments or other nonprofit groups that do work in specific areas. One tangible area that we work with right now with our Health and Human Service Agency is around our school-based health center program. For instance, we have dollars in our state budget that we work with them to Medicaid match, and we have like a $20 million program that over 100 funded sites across the state that help provide physical and behavioral health supports to some of our neediest students. So that's a clear partnership that we have. On the kind of health, on the PE and nutrition side of things, we do joint awards to state awards annually to identify and support and give kudos to schools that are making positive gains and making changes to their school health environment. So in our state, while we give a lot of money to schools as part of our state aid, our Health and Human Services Agency takes up like a third of our overall state budget. So they have a lot of resources, and they have a mission and a desire to serve adults and kids and needy parts of our state as well. So having that partnership, having that marriage is important for both of our agencies, and our health center program is just one of the ways that we're doing that.
Great, thank you so much. So we're going to go ahead and wrap up our webinar. Just wanted to extend a thank you once again to our presenters, and thank you to all the participants who joined us today. We really appreciate you giving us some of your time, and we will be following up later this week with an email that includes a link to some of the resources that were mentioned today, in addition to a link to download the slides and a recording. So thank you so much, and we hope to stay in touch with everybody. Bye.